My name is Alexandra Milspaw. I'm the Director of Behavioral Health Services here at Pelvic Rehabilitation Medicine. I originally got into the field of sexual health and pelvic pain when I was in college, working with the vagina monologues and putting those productions on. And I also started the Gender Violence and Sexual Violence Crisis Line at Lehigh University. So when I was doing the crisis line and working with a lot of the women, I definitely found a pattern of their history of trauma and them reporting any type of pain issues, but definitely sexual pain issues. One of the women that raised me had a long trauma history and a pretty stressful life, and I could recognize that she also had a lot of chronic pain issues. So I always wanted to understand what was going on there and why she couldn't get the help that she deserved, and I wish that she would be able to get. And while I was in grad school at Lehigh, I saw a guest speaker who was Dr. Robert Eckenberg, and he happened to be a specialist in chronic pelvic and sexual pain issues. And in his presentation, he talked about the direct correlation between a history of trauma and any type of trauma, but history of trauma and chronic pain. He was just tying everything together, and that was the first time I saw someone finally bridging the gap between the medical world and the psychological world. And it was kind of love at first sight, and I said, yes, this is exactly what I want to do. And then I started really assimilating information from all over. I was reading a lot of research within the mindfulness world, and they started doing fMRI scans and looking at how the brain was before and after mindfulness training and brain exercises. But then I saw a gap there too, because they were working with mostly healthy subjects, and certainly subjects that have anxiety and depression, but I wasn't seeing a lot of good results with chronic pain and trauma. And so then overlapping that with the research in the trauma world, then I was like, okay, we need to help heal the brain in order to be able to do the mindfulness. And then once we do the mindfulness, we can heal the brain even more, and then we can start updating the software. So that's become my new tagline of we need to heal the hardware if we want to update the software. And that really helps bridge that gap between the medical and the psychological world. So much of medicine and psychology, we zoom in and only look at specific symptoms, but we forget to look at the bigger picture. One of the things that I love about what I do is I really try to help people connect the dots between their experience, their life history, their autobiography, as well as their physical symptoms and manifestations of stress, and try to help them understand it so it doesn't have to be so scary. For more information on behavioral health services here at PRM, visit pelvicrehabilitation.com.